If you're just joining, you're welcome. So tonight we want to talk about menstrual blood. We'll look at menstrual blood with respect to the color of menstrual blood. We'll look at it with respect to flow, menstrual blood flow. Is that Lewis Catherine? If you're here, tell me you're here. All right. So we'll look at menstrual blood with respect to the color, the flow, and the duration. What is normal? What is abnormal in all these categories, right? But remember that your body have a way of notifying you if something is ever going wrong. So are we ready for this gist tonight? If you're ready for tonight's gist, talk to me in the comment section. Just type ready. And please make sure, if you have to call them on phone, all the women in your life, call them on phone. Tonight we're talking about menstrual blood. Let us understand this thing. Alright? So call them on phone, share the live to them, get everybody to come here now. Because we are ready to take off and go. Right? Alright guys, let's begin our discussion. Right? And the discussion is menstrual blood. Idara is here. So remember, we have three parts in this gist. Part 1 is menstrual blood color. Part 2 is menstrual blood flow. Part 3 is menstrual blood or bleeding duration. So that is the three parts. You don't want to miss this information for anything. In fact, where else would you be in a night like this if not here learning something? All right. If you're just joining, let's begin. So I was saying earlier that you see that most people were never taught how to interpret menstrual cycle. Right? Interpret? What do you mean interpret? They didn't even tell you that you were supposed to expect it. You just grew up 16 years, 12 years, you saw something and you were afraid. That's how many people got to know about menstrual blood. Nobody tells you nothing about this menstrual blood. Nobody tells you nothing. You just discovered it yourself and you learn in the process, right? Such is your story. Right? Nobody tell you about it, but the thing about menstrual blood is it's a notification. You can read it and interpret it and understand what's going on with you. But because you don't know, a lot has been going on with you and you're just, I don't know, right? And the only time you go to seek for help is when the problem would have worsened. But tonight we'll change that story, so that even if you are a grandma, you are a mother, or you are planning to be a mother, you have an information that you use for yourself or for others. Is that okay? Right? Is that Ella Star? Welcome. Right? So I was saying that most people were never taught how to interpret a menstrual cycle. And you wonder, so they interpret them? Yes, they interpret them. They interpret them. So when the blood changes color, when the flow becomes heavy, when the duration suddenly shifts, either shorter or longer, are you supposed to interpret it? Right? In fact, the reaction is usually, maybe it's normal, maybe just one of those things, right? Sometimes, you say, oh, don't worry, it's normal. Your body will come back to normal later. But remember, sometimes it's your body that is quietly giving you signal. Remember, it's a notification. Your body is giving you signal. Say something is up or I am okay, right? And now, if something is wrong, the body is giving you signal with respect to hormonal imbalance. The body is notifying you with respect to ovulation problems. The body is using the menstrual blood to notify you about inflammation going on inside of you, right? Just a minute. How did this music change? Sorry, that's not the one. This is the one. Right? So your body is giving you signal about stress. You don't know that you can use your menstrual blood to know that you're stressed. Anyway, that's why you're here tonight. So you will learn. You'll learn something tonight. Even you can read out fertility related issues just by interpreting your menstrual blood. So we're going to do this properly, right? We're going to dissect the menstrual blood like you would do with a report. Let's look at it. Let's dissect it. Let's interpret it. Let's divide it so that everybody will understand. Oh boy. All right. You know why we have to do this? Because your period is not random. Your period is not random. It is one of the what do you call it now? It's one of the clearest window. Your period. It's one of the clearest window that you can peep through to understand your hormones. You peep through that window to understand your ovulation and your uterine health, right? And even reproductive balance. Hello, Irene. I see you. You're welcome. The menstrual blood. You never knew that monthly, they call it monthly visitor, right? It was so important. You thought it was just to make you a woman, and when it doesn't come, you're supposed to be pregnant. It's more than that. It's more than that. So we're going to use it to look at the issues, what is going on. So who is ready? Let's talk about the first thing. The first thing, as usual, is go back to the basics. The basis is this. Let's go and find out what menstrual period or menstrual blood actually is. What is this thing? We talked about it the other day anyway. A few days ago we did. But tonight, what is this thing? Let's go back to it again, right? And to correct, there's this erroneous idea that menstrual period is dirty blood, right? Oh boy. Anyway, I want to disappoint you. Menstrual period is not dirty blood. It is not. Menstrual period is, from what we said the other day, a few days ago, is the shedding of uterine lining. Uterine lining is part of you. So it is not dirty blood. Otherwise, it is you that is dirty, right? So it is the shedding of the uterine lining and breaking down of blood vessels that were built up in expectation for pregnancy, right? I see fiberglass is here, right? Even cervical mucus, tissue fragments, all these things put together is what make up the monthly period. Christy LaBelle is here, right? So what is menstrual blood? What is menstrual period? It is the shed menstrual lining. It's blood that came out of broken down blood vessels, cervical mucus, and tissue fragments put together. That is that thing you are seeing called menstrual blood. So menstrual period is not dirty blood. Hello, Christy LaBelle. Right? And all this is released because the reason why you are saying that is because pregnancy did not happen in that cycle. So it's not dirty blood that is coming out. No. It's only coming out because pregnancy did not happen. If pregnancy happened, all those things will remain in their place and nourish the baby until it becomes a human being. So it is not dirty blood. If I hear dirty blood again, so every period essentially, right, is like a report card. Every period is like a report card of what happened hormonally over the last months. So when you see your period, you look at it and interpret it. You say, oh, okay, this is what happened last cycle, right? Oh boy. So easy to understand. It's not a big deal. So let's start with the first part. Right? I told you we have 3 parts. Let's start with the first part. That is menstrual blood color. Menstrual blood color. What they really mean when you see them. Who is ready for this I'm about tonight? Right? Especially African men, at the sight of menstrual blood, they are offended and irritated. Right? You won't blame them. They are not women to get used to that kind of thing. Right? But I actually want men also to listen to me so that they'll understand what we're talking about. There's nothing wrong with menstrual blood, just that we don't want it to be smeared all over the place. Right? Right? Hey, Melissa King. Good to see you. So let's talk about the first part. What menstrual blood color, what they really mean. So we're going to look at the color and different shades. So we're going to look at different shades of menstrual blood. Oh yeah, Dr. Pat, men will not always be in a live stream like this, right? So they would rather be playing football somewhere or pursuing the other gender. Anyway, let's continue our gist. So let's start. So we're going to talk about the different shades and what the different shades of menstrual blood is telling you, right? So that's what because the color is not random. The color is not random. You say, oh yes, this month I saw this color, that month. No, it's not random. You got to understand. It is a report card. Exactly, Dr. Pat. But don't worry, we have women that will always go back and teach. Right? So, color is not random when it comes to blood, menstrual blood, right? The color reflects. Listen, I want you to understand it. The color of menstrual blood is supposed to reflect the oxygen exposure of the individual, right? That's one. It reflects the flow speed. If you were here 2 live streams ago, I was talking about clots, menstrual blood clots. I talked about the speed, if it's too fast and if it's too slow, right? If you remember. But if you cannot remember, don't worry. Just go to the YouTube channel, it's there. Right? So the menstrual blood reflects, the color of the menstrual blood reflects oxygen exposure. It reflects the flow speed, how fast or slow the menstruation is coming. It reflects the age of the blood, right? I also reflect hormonal patterns, right? So, having known all this, let us now take the key and decode the matter, right? Can we decode this thing tonight? Let's do that. Let's decode it with the first. Let's start with the first one. Bright red. Bright red. And bright red is usually the normal menstrual blood color. Yeah? It is. Bright red. When you see this bright red, actually would mean that it is fresh blood, right? Bright red means it's fresh blood. It's telling you that the flow is active and the shedding of the uterine lining is effective. That's what it's telling you. Bright red. And you see this coloration usually at the early or at the peak flow days, either when the flow just started or at the peak of the flow, right? So that's where you see this coloration. I'm talking to women, so they know this thing more than me, right? Right. And this is commonly associated with good flow dynamics, active uterine contraction. Everything is just A-OK, right? Everything is just A-OK. So that is the first one, which is bright red blood. And that is a normal menstrual blood color, right? It shows that everything is just all right. Right, so let's look at the second one, which is dark red or brown blood. Some people call it chocolate, right? In the simplest way to understand it, it is usually older blood, right? But brown blood is the blood that took long to exit the uterus, right? Or they have been oxidized over time. Oxidized, don't worry about the big name. Oxidized means broken down. Blood that has been broken down over time appears dark red or brown. Am I talking? Am I making sense? Who is here? Am I making sense? Talk to me. If I'm making sense, just type yes. If I'm not making sense, type no. And if you are just coming, don't say anything. Right? So we're talking about dark red or brown menstrual blood. You're right? And I said brown blood is the blood that took longer time to exit the uterus, or it has been oxidized over time. Oxidized means broken down. So make English language no confuse you, right? And you will notice this. You will notice this commonly at the beginning or the end of periods, right? There's nobody that is more expert in this gist than women. So I'm telling you my experience over the years. So you tell me your experience from your own biology, right? So this brown blood or dark red, usually you see commonly at the beginning of the period or at the end of the period. Why is it so? Either it has been oxidized over time, or it took longer time for it to come out. That coloration is just giving you an idea that now old blood be this. Because I know that some people have run to the hospital. Oh my God, I'm seeing dark. So I say all that to say, usually, if it is occasional, if this kind of thing happens occasionally, it is harmless, right? So calm down. But if you are having a persistent dark discharge, it may suggest that the shedding of blood is slow. It will suggest that there is hormonal imbalance. It also suggests that there was retention of old blood. That is what is. Remember, your menstrual bleeding is your report card. It tells you a lot. So I'm only helping you to learn how to read that report card and interpret it for your own help, for your own purpose, right? For your own purpose. So that is dark blood or brown blood, right? Now, if this blood, your network is terrible, oh my God, why is your village people doing you like this? So if this blood is now black looking blood, oh boy, black? Is it possible? Yes, I'm telling you tonight. If it's black looking, this usually would indicate that blood remain longer in the uterus before exiting. So remember, in the other one, they took time, they were slow before they exit, so they look dark red, brown. Now, when you take even longer time, it's definitely going to be looking black, right? And it can occur with very slow flow. Yeah, very slow flow. You can see black looking blood, or delayed shedding. That's where you can have that. And now this is the thing. If it is associated with pain, Chris Laver said, my village people go sit onto. Oh boy. So I was saying that if this black looking blood is associated with pain, bad odor, fever, then what you are dealing with is infection or retained products. You may just be dealing with one of the two, right? Is it not becoming simpler for you to understand? Is it too big? Is there somebody, this is too hard for you to understand? Talk to me. Is it hard? No, it should not be hard. Life is not supposed to hard, right? Life is not supposed to hard. And I'm sure that tomorrow when you see these changes, you already know what it is. You know when to go to your doctor, and you know where to wait. You know what to do by the time we are done today, right? So that is black blood. Let's talk about pink blood. Pink blood. Now, pink flow may occur when the blood mix with cervical mucus. Christine Labasi is not right? Pink flow may occur when blood mixed with cervical mucus or estrogen levels are low. That would amount to pink blood. And you will see this in very light periods. Very light periods, right? Or those who have ovulation disturbances, right? Ovulation disturbance is actually a hormonal issue, right? And in such cases, you have low hormonal support, right? So you look at it and you're already interpreting what's going on here. Ovulation disturbances, low hormonal support, yes. And sometimes it's associated with weight loss, right? Associated with weight loss, associated with stress. And if you were here before, I've talked about the hypothalamus pituitary ovary, the head to ovary connection. So you already know what I'm talking about. So when there is a suppression in that tract, you see Madam Pinky appearing. Blocked tube is not a normal thing now. So blocked tube is not a normal thing, right? So that is for that is pinky, right? So let's look at the other one. When you now see grayish blood, gray. Are you serious? Gray menstrual blood? When you see that, you should never ignore it. This is abnormal, right? And it may suggest infection. It may suggest tissue breakdown, retained products, right, in pregnancy, in some contexts. That is, if you depend on the presenting patient anyway. But when you see that these are the possible suggestions, it's telling you infection, tissue breakdown, or there is a retained pregnancy tissue, right? Especially if it is accompanied with offensive odor. Yeah, offensive odor, fever, and pelvic pain. You already know what you're dealing with. You're dealing with some serious abnormal situation, right? So you just go and see your doctor. You need to be treated. Is that okay? Everything I've said now is with respect to menstrual blood color. If you are still here, you understood anything I just said, please talk to me in the comment section. Just type understand so that I know somebody's understanding something tonight. Oh boy. Right, then we'll go to the part 2. By the way, if you are trying to conceive and you have not downloaded this ebook, The Preconception Blueprint, a practical guide to prepare your body, your mind, and your life for pregnancy, I don't know what you're waiting for. Go and download it. Start doing it. It's a practical guide. It's a manual, right? You learn and do and learn, right? you read a knack, right? So if you are not knacking, you are in trouble. By the way, from tomorrow is Friday. All those that are not knacking, will expel them from the live stream, so that they'll go and learn how to knack. Read, knack it, exactly. That's how to use this book. Download this book. Go to the link in my bio. You download it from there. You read this book, go and knack and eat. Come back, read again, knack and eat. That's how to do it. After 6 months, we will see whether you know carry belly. All right. Let's continue. Let's go to the part 2. Part 2 of the gists. Part 2. Oh boy. Part 2, we should be talking about menstrual flow. Right? Part 1 was color. So part 2, we want to talk about menstrual flow. Who's ready for this gist tonight? Part 2 is menstrual flow. Part 2 is menstrual flow. If you are just joining, you're welcome. If you have not followed me, follow me now. Follow me, especially if you are trying to conceive. Follow me. All right. So in this part 2, we want to ask the question: how much flow is normal flow? All right. How much flow is normal flow? Because now we're talking about quality. We're talking about quality. How much menstrual blood flow is normal flow? We're talking about quality. But the thing I've noticed over the years, most people judge menstrual flow emotionally. Right? Oh, my flow is much. My flow is too scanty. They're just emotional about it. Hello, Lola is here. Hello, Lola. How was your day? Good to see you. Welcome in. Right? But biologically, we look at patterns when it comes to menstrual flow. We're not discussing emotions here. Look at patterns. What is your menstrual flow like? So let's start with what a normal flow would be. Right? The typical menstrual flow, right, would last anywhere from 2 to 7 days. So either your own is 2 days, another person is 3 days, another person is 4 days, another person is 5 days, another person is 6 days, another person is 7 days. A typical normal flow would last anywhere 2 to 7 days. Right? And the heaviest, right, of the flow is in the first few days. That is what normal would be. So the first few days is the heaviest, then it tapers. It begins to reduce gradually until it eventually stops. Right? So I'm talking about you, so you already know about you, right? So, long story short, the uterus should shed efficiently, normally, right? Have you not ever wondered how is it that without you doing anything, the uterus will shed menstrual blood and clean it out nicely, so clean, as though nothing was there before? Have you ever wondered how does it do that? All right, if you were here a few days ago, you already know. Lola Man on get mind of his own. No, he's not having mind of his own. You pay attention. He's telling you something. He's telling you something. He's telling you something. When you begin to see changes, it's a notification that, hey, you want to check me out, right? So pay attention. So I was saying that the uterus can nicely clean out itself and look so clean, right? So the uterus should shed itself efficiently by contracting effectively. Remember, the uterus is not just there. No, is in a constant state of contraction, right? Then when it's time if pregnancy does not happen, and menstrual bleeding is about to start, the uterus begin to strongly squeeze out. Then all the menstrual wall begins to crumble, and so is that process that leads to what you're seeing. So don't worry about that. But long story short, the uterus should contract effectively to make it happen, right? If you're just joining, you're welcome. If you're trying to conceive, follow me, right? And go and download the book, The Preconception Blueprint. Link in my bio, right? And menstrual blood usually does not just stop abruptly. No. It stops progressively. So from its peak flow, it begins to tapers down gradually, slowly, until it vanishes. Right? So that is what a normal would be. Coffee is here. So that's what normal flow is. So what then is heavy flow? What do you regard as heavy flow? Okay, this is what heavy flow means. Heavy flow is not just an inconvenience, even though it is, right? But it's not just an inconvenience. Good evening, Coffee. Good to see you. Heavy flow usually would mean one of three things I'm going to mention now. So I'll need us to tap on our screen so that more people will come and learn this one of three things. Especially women. Call them on phone. Come and hear this thing now. But if you don't hear now, you come and meet me in the clinic. You go pay, right? So, heavy flow, right, usually would mean one of three things. One of three things. Who is ready for these three things? Talk to me in the comment section if you're still here, you're listening to me. Make sure you're tapping on your screen, sharing the live, and you're learning. You've got to learn. And if you have not dropped a heart me, this is the time you need to drop a heart me. All right? Drop a heart me, right? So that we'll know that you are appreciating what we are doing. Is that okay? So number one of the three things that heavy flow is trying to tell you, number one of the three things is, number one, there is excess endometrial growth. In other words, the inner wall of your uterus grew excessively, right? Too much lining is built up. Why would that happen in the first place? That can happen from estrogen dominance, right? Don't worry about that part, but at least you should know. Estrogen dominance and lack of ovulation. All right, so this is the reason why the uterine lining can be built up excessively. And that excessive endometrial growth, when it begins to shed, it's going to shed heavy. Right? It's going to shed heavy. So at least we now know that estrogen is part of the gist. And lack of ovulation. Right? The second reason for heavy flow is poor uterine contraction, right? Poor uterine contraction. You have normally the uterus is not just compressing the in this case it is not compressing the blood vessels effectively, right? And you see that where there is fibroid or adenomyosis, because the normal contraction that should shed out all this blood normally is impaired because of fibroid presence and adenomyosis. Is that okay? That is second. The third reason is clothing regulation issue. Now, if you were here yesterday, we talked about the anticoagulants that make menstrual blood not to clot and appear clumpy at the time of menstruation. Now, where there is a problem with that system, that is what I mean by clotting regulation issue. Is that okay? That's what I mean by that. Right? The body cannot regulate bleeding properly. That's what it means. Understood? If you understood anything up until this point, talk to me in the comment section. Just type understand. Right? Type understand in the comment section. So I need to pay attention if parts soak very quickly. That is a sign of heavy flow. Are you counting? Number one. Number two, if you see large clots occurring frequently, another sign of heavy flow. Number three, fatigue or dizziness develops, another sign of heavy flow. What number now? Number four. Yeah, number four. The bleeding interferes with your daily life. That is a sign of heavy flow. Right? That's a sign of heavy flow. You see, chronic heavy bleeding can lead to iron deficiency and anemia, reason for the fatigue, dizziness, and all that. Do you understand? So that is all the sign you see in excessive flow. So take notes and change your life. So let's go to the part 3 of the gist, right? The part 3 of the gist is menstrual flow duration. Menstrual flow duration. How long should a period last? Thank you very much, Ivy. Thank you very much. How long should a period last? Right? How long is your own lasting? So how long should a period last? But I'm asking, how long is your own lasting? Right? 6 or 7. Oh, that's great. 2 days. Okay. It's still within the range. Yeah. Still within the range. 4. Great. So right? So what is normal? 4. Great. What is normal? Generally speaking, what is normal is 2 to 7. Right? 2 to 7. And everybody do not have the same duration. So stay your lane. Stay your lane, right? What is important is consistency. Is the consistency, right? If that's why when people come and complain, I'll ask, when did it start? There's got to be a time the problem started, or maybe the change started, right? Because your body gives you signal and it tells you when the problem starts. That's how we are teaching you how to prepare yourself, how to prepare your body. The body must be prepared. The body must be cultured. The body must be trained, right? You want to born pikin, train your body to born pikin, right? So that when you knock wetin no good like this, pikin go enter. So thank you for the heartbeat, right? So that is that. So I said that is normal. That is what normal is, right? Can we calculate a period that starts by 7? How? ID. Okay, I'll come to your matter later. Is that okay? So, very short period is what I want to look. She wanted to make me forget, so that's why I was trying to whether to answer or not to answer. So, very short period is what I want to talk about. And when you have very short period, it suggests low estrogen. Yeah, so just low estrogen. It also gives you an idea that your ovulation is weak. Oh, if you missed all the gist about ovulation, go and find it out in my YouTube channel. Then you understand what weak ovulation means, right? So very short periods will mean low estrogen, weak ovulation, and thin endometrial lining. Endometrial lining is thin, right? Especially if the flow is consistently scanty. I did not say a flow that became very short yesterday. No, that's not what I'm talking about. It's consistently very short. Then it means that something is up. Is that okay? You know something is up. Kafi, your own is within the normal, 2 to 7 days. You self calm down. So you want it to be rushing like waterboard? Now that is very short period. Now what about prolonged periods? Right? Prolonged periods. Now bleeding that is lasting more than 7 days. Remember, normal is 2 to 7 days, right? So bleeding that is going far and away beyond 7 days, or there is this recurring irregularity that is noticed. It may indicate hormonal imbalance. Yes, you will. Beautily, you will. Beautily, talk to me. When was the last time? Today is Thursday. This week alone, how many times have you knocked? I'll come back to the gist, but I want to attend to this matter. Beautily, talk to me in the comment section. In this week alone, how many times have you knocked? If you don't like knocking, get out of this live stream. It's not for you. You are not answering me this week alone. Once, you see, you are not knocking. Your problem is knocking, right? You should knock like 2-3 times a week. You have not even met your quota. So go and meet up your quota. But if you have any other major concern, we will help you with it. But for now, what I know so far in the past weeks. Okay. What I know in the past month, Most of the people who are trying to conceive, they need a knack, but they want to conceive. How is going to happen? It's not magic, right? So if your partner is far away, pack your things, go there. Why? Because knacking is part of the work that needs to be done. All right. It's not easy to knack. ID, if you come to the live stream tomorrow, you will be among the people that we are going to judge your case, right? We are going to pass a judgment. Those people that are knackless will be disbanded from the live stream. Only knackers will be allowed in the live stream. All right, beautifully, it's okay. We'll attend to your questions when it's time. I beg, knack waiting no good. I beg, please. Knack waiting no good. So tomorrow is Friday. I'm actually going to pass judgment on those who are not knacking. Because you cannot say you are trying to conceive and you're not knacking. I don't understand. Let's go back to the gist. So where was I? On the gist? So we're talking about prolonged periods, right? Talking about prolonged periods. And I was saying that bleeding that lasts more than 7 days, or there is this recurrent irregularity. God create people. Mario, your matter don't pass. Be careful. I don't get your power again. Okay, please confirm. Go to your doctor and confirm that you don't have some kind of infection-related issue, right? Because sometimes vaginosis and all those vaginal stuff can cause problem, right? So please make sure. But if you don't have any problem, it's fine. You can always maybe you may even need fertility. English is hard. You may need lubricants that supports fertility, because it's not all lubricants in the market that supports fertility. So you may need lubricant. It's going to help you. Is that okay? All right. And I just quickly buttress that part. Please, it's not every lubricant in the market that you should go and buy. Majority of the lubricants in the market does not support fertility, right? You just do knack, waiting no good, and go and rest, right? But there are lubricants that supports fertility. Hello, Dr. Godwin, Rock, and Thara. Good to see you. So make sure you buy the one that supports fertility. Don't just go and buy. Is that okay? All right. Maybe I should even start selling so that when I go to buy. Don't come and tell me that you don't want to knack because the knacking is not knacking. All right, where was I? Yes, I was talking about prolonged periods. And I said that bleeding that is lasting more than 7 days. Is that Yudi? Yudi is here. Hello, Yudi. Good to see you. You're welcome. So fine. Thank you for the likes. So, bleeding that lasts beyond 7 days or recurring irregularity is a concern. Right, and it may indicate hormonal imbalance, fibroid may be the problem, endometrial overgrowth, especially in the case of where estrogen has dominated the show, right? You can have endometrial overgrowth and even ovulation dysfunction. These are the kind of things you see in prolonged periods, right? So your body is telling you something. Are you listening to it, or you just carry pad cover up. There are all manner of things people do, right? I think there's one now in the market that they actually just put inside the vagina. How do you? Anyway, just do you, right? Just do you. I'm wondering at many things. All right. So I hope it's safe. That's just what I wanted to say. I hope it's safe. Because anything where we both produce, I need a thruster. Right? Anyway, where was I? So let's continue our gist. Right? How does all these things we've been talking about, how does it connect to fertility? Because that's what we're all about, fertility. In the end, our discussion must end in how to get you to be successful in reproduction, right? Because your period is not just about bleeding. If that's what you think period is, you are wrong. Period is not all about bleeding. It's a report card. It's a notification about you. So you don't become offended when you see these things. Right? And I'm sure guys are here. Guys, you too, don't be offended when you see it. Learn how to read it. Learn how to read it. Because men are really not interested in that place. Their own is they won't knock. Just clear road, make a knock. That's all. Whatever happens there after, then no concern me. All right. So I said all that to say that your period is not just about bleeding. It's a report card. And it reflects a lot of things. Right? It reflects a lot of things. If you're just joining, you're welcome. If you have not followed me, follow me now. Tap on your screen, share the live. If you're trying to conceive, go and download this book, The Preconception Blueprint. Go to my bio, my profile. See that link? Tap it. Go and download it. Do what we say to do. We'll see whether you know get belly. All right, where was I? So the period reflects whether ovulation happened. Number one. Period reflects whether ovulation happened. And of course, if you see your period, it means that pregnancy did not happen. But we're not talking about pregnancy. We're concerned about the ovulation. Go back to the video from the beginning. If you missed the beginning, go to my YouTube channel. Go and watch it tomorrow or the day after tomorrow. The video will be on the YouTube channel. Dr. Godwin EMB is the name. Search it and listen. So, the period reflects whether ovulation happened. It reflects whether hormones are balanced. It reflects whether your uterine lining developed normally. Because anyway, for periods to flow, it means that the uterine lining will have to break down and flow, right? So these are the things it reflects. It's a scorecard. That is why menstrual changes matters a great deal in fertility. When you see the shifts, you see the changes, you should be concerned because this thing matters in fertility, right? It matters. If you will pay attention, you'll catch a lot of things that you may likely miss. What is the question, Rock? What is the question? Rock and Atara. What is the question? Right? So if you understood anything I just said, at least it's only fair for you to know what healthy menstrual function usually look like. right? A healthy cycle often would include predictable timing. So just lift up your hand if you cannot predict your cycle. Memuna said what you take, but I know you are new in this place. I know you are new, otherwise by now you know that I'm not the take type. Okay, you missed yesterday's live stream. Rock, what you're asking is what I talked about yesterday, right? What you're asking, I talked about it yesterday. What normal cramps is and what abnormal is. Yes, there are normal discomfort that comes in period, and I talked about what you see and feel to know that is abnormal. So I know you missed that. Don't worry, that video will be on my YouTube channel. Go to Dr. Godwin AMB. Go and watch that video. It's 59 minutes video. Detailed explanation, right? So I cannot explain it in just 2 minutes. It's a detailed explanation, right? So go there, it's going to help you. But if you still have any concern, drop a DM. Is it a DM or a comment in the YouTube channel? I will attend to you specifically, right? All right. So I was talking about what a healthy menstrual function should look like, and I said it should be predictable. One person raised up their hand because they cannot predict. You should be able to predict, but if it's not predictable, then we need to zero in on your matter. What is the problem? Because your menstrual flow, color, duration is a report card telling you that something is right or something is not right. Is that okay? That's number one. Healthy menstrual function should often include moderate flow. Right? I just talked about today what the extremes will be. Short flow, prolonged flow. That's what we just talked about. But you should have moderate flow. Duration 2 to 7 days. The color. Where is your location? I'm in Nigeria, Abuja. Healthy menstrual flow. Yes, you can have clots, right? But minimal clots. And I've talked about that day before yesterday. So you go and check out the video. Minimal clots. So if you are seeing clots in your menses beyond what we said it is, that is a source of concern. And I told you why. So minimal clots. And if there's any discomfort during your menstruation, it should be a manageable discomfort. But the one that you roll on the floor, tear down the curtains, jump through the roof, and the whole house you cannot even function again because you are seeing menses. It's not normal. It's not normal. No, Rock, it's not true. It's not true. Don't miss my live stream. You're asking this question because you missed my live stream. Stop missing the live stream. Right? So, long story short, it may not be perfect consistently, but just understand what is normal with you, right? Then follow through. So that if there is a shift, you can go to your doctor and say, oh, this is what I noticed recently, and I want to know why. That way you'll be able to understand, because the body is coordinated. The body is not random, right? And your menstrual flow is not just blood that the body doesn't want. No, it's not dirty blood. There's nothing like dirty blood. It's a combination of many things: mucus, tissue, fragments, blood, right? And all that is supposed to nourish a baby that did not come. So it's shedding out. So it's not dirty. Is that okay? All right. I'm becoming tired, but I will not do you justice if I don't tell you what disrupts menstrual health. Because I want you to be healthy. Right? I want you to be healthy. Thank you very much. What disrupts menstrual health? Right? I just remembered, some patients can be very wonderful. When you are particular about your health and you really need help to understand, you throw away shame, right? I used to have a patient years ago, right? Before you know, by the time you're waking up in the morning on your WhatsApp, pictures, say, doctor, what is this thing? Can you see that menstruation? See something at the center? What is that? It's funny, but I think I appreciate the fact that this person cares about her menstrual health, so they want to know. So that's why the detailed information I'm giving you, so that you don't need to be snapping too much pictures, right? Hello, pretty Olay. Good to see you. All right, you know that many things can alter the cycle. Many things, right? For example, hormonal imbalance is one of those things, right? Under which you have PCOS, polycystic ovarian syndrome. If you missed that discussion, I had 3 live streams on PCOS alone. Go and find them out. Go to YouTube, Dr. Godwin EMB. Type PCOS. All the videos will come out. Listen to it over and over again. It will change your story, right? So, one of the things I'm talking about under hormonal imbalance, PCOS, and PCOS is not just one thing that is causing it. There is the insulin resistant part of it. There is the male hormone part of it. There is the weight related part of it. Right? So go and watch that video and make sure you see your doctor so that they can help you. Right? There is thyroid dysfunction. Also go and find thyroid video on my YouTube channel. Listen to it. What is the role of thyroid with respect to your menstruation? And that is why till tomorrow I will always praise Kathy. Kathy, is she here? Kathy, are you still here? That's a very remarkable person. She will hear something, she quickly go and find out. That is somebody who wants answers, right? And we're getting answers. Before this year run out, you will get a miracle. Right? There's also elevated prolactin. So, these are the hormonal related imbalances that can cause, that can disrupt your menstrual health. Right? Now, there is the metabolic side of it. What is metabolic? Metabolic is just how your body use up energy. So it's not a big grammar. There's the metabolic side of it. Like I mentioned earlier about insulin resistance. It's more of a metabolic issue. And extreme weight changes. Remember the other day I was talking about Orobo and Lepa? Who was in that live stream? Who was in that live stream? So I was saying that you cannot be too big and you cannot be too thin, right? You've got to be normal. So if you are too big, you want to cut down. If you are too thin, you want to add up. Why? Because The both extreme is not favorable for your fertility. I don't understand the question from Gambia. What is normal? I will say what is normal. Normal is just make sure you know your BMI. Right? Know your BMI. If you can stay within the normal range of BMI, you have taken care of the weight issues. But then if you are if you are overweight, please don't try to cut down weight sharply. It has to be a progressive thing, because sharp cut down of weight or sharp increase of weight also affects the reproductive health, right? So you got to be smart. So if we say you are too big, it does not mean that tomorrow you want to cut down 10 kg. No, please don't do that. Don't do that. Just have a routine, regimen. English. All right. Stress can disrupt your normal, healthy menstrual health. Stress. Remember cortisol? Oh boy. The almighty cortisol. Cortisol will disrupt ovulation signaling. You see why I always preach sleep and stress management. There is no day I don't talk about sleep and stress management. If I ask here now, how many of you in the past 1 month have had consistent 7 hours sleep? By the way, you cannot sleep too much. So don't now go home and say, oh, doctor said we should be sleeping. Then you now sleep the whole day. I did not tell you that one. Right? So I said that to say that cortisol will disrupt ovulation. And the way to deal with this cortisol thing is to manage your stress and have adequate sleep. Do that and you'll be all right. Including for men. It's also a solution for producing precious sperm. Right? It is. So men, if you're here, you don't know what I mean by precious sperm, go to my YouTube channel, Dr. Godwin EMB, right? 30 videos are there for men alone. It will teach you step by step what is affecting your sperm. And 90% of all the issues that affect male reproductive function are reversible. So why are you still suffering? 90%! And you're still suffering? Go and study it. Go and watch the videos for free and change your life. Right? That your John Thomas can stand strong and long does not mean that you are fertile. Go there. You understand what I'm talking about. Is that okay? All right. How did I get there? Let's come back here. So I was talking about stress. And I said that cortisol, which is a stress hormone, will disrupt ovulation signaling. So cortisol can make your ovulation be delayed, shift, or suspend it altogether. Right? So that is I think the third thing that can affect your normal menstrual function. The other thing that can affect it is uterine conditions. There are several uterine conditions, but 3 of them stands out. The issue of fibroid, the issue of adenomyosis, the issue of endometriosis, which I've talked about extensively, right? Go to my videos. I've talked about fibroids in several videos already. Adenomyosis is there. Make sure you are learning. If you are not learning, there's nothing I can do for you. Right? If you want to have me one-on-one in your DM, go through the link in my bio. You will see the consultation on my digital store there. Tap on it. It will take you to my green app. All right. So where was I? But for us to do justice to all the discussions, right? Let me just help us understand. how to keep the menstrual health balance, right? Just something small, so that when you go to bed, you know that you've learned something that can change your life, right? Who's ready for that gist? This is like the last thing I'm going to talk about before I let us go. Talk to me in the comment section. Are you ready? Or I should just leave it alone? Right? Are you ready? Or I should leave it alone? Well, I cannot leave it alone because subscribers are here, people tapping, people gifting, so I must do justice to it. So, how do you keep your menstrual health balanced? And this is very important because sometimes we just go about our life not because we want to cause damage to ourselves, but because we don't even know, right? And this is where a lot of people usually expect a miracle. They expect miracle cure. Of course, that's why all these herbs, pills, and everything, that's why it's selling, because you don't know what to do, right? But listen, menstrual health is mostly about supporting the hormonal stability, right, and proper ovulation. It is. So what are you supposed to do? Let me itemize it so that it will be easy for you to remember. The first thing you want to do is to support ovulation. Yeah, support ovulation, right? Ovulation stabilizes progesterone, endometrial development, and cycle rhythm. Ovulation, that's what it does. So if you would support ovulation by first dealing with what I mentioned earlier, then you are right on the way. And what did I say? One of the greatest enemy to ovulation is stress. So cortisol just go up like this, and it begins to disrupt ovulation signals. So if you can do the right thing, go to my videos in the YouTube, search ovulation, the details are there, but I need to tell you this one. So you want to support your ovulation. Why? Because ovulation itself can stabilize progesterone, can stabilize endometrial development, and your cycle rhythm. And you can deal with the greatest enemy, which is cortisol, stress hormone. Manage your stress, have good sleep. Then, of course, eat well, knack wetin no good, and you are good to go. That is the first thing. All right? The first thing to support. Thank you, Dorak. So the first thing is to support ovulation, right? The second thing is manage stress. So why are you stressed? You know, the other day I was talking about stress, right? Somebody, I can't remember who that is. Somebody said spouse can also be a source of stress. See how stray bullets touch our spouses. Right? So spouse also can be a source of stress. So whether you are the woman that is causing stress or you are the man causing stress, please stop it. We need a healthy menstrual function so that we will be born pikin, right? So manage stress, whether it's a physical stress, emotional stress, or psychological stress. Manage stress, right? Manage stress. Why? Because chronic stress will alter you actually cause hormonal changes. Because in chronic stress, what happens is that cortisol goes up and remains up perpetually. And what does that do? You now begin to have hormonal signaling that is doing it. I don't want to mention the names so that you don't get, when people hear big names, they just shut down. So that one is not for me. But it affects hormonal signaling that is coming from here, from the brain, right? And therefore, it will affect ovulation timing. Chronic stress. So if you will manage your stress, you will notice that this irregular menstruation you've been having all of a sudden becomes regular. It works like magic. You say, wow, what happened? You did not take anything. All you did was just to manage your stress. And I'm thinking about you. When are you going to manage your stress? Hey, Sheila. When are you going to manage your stress? When are you going to do something about stress in your life? All right? Do something about it. Then another thing you need to do is to protect your metabolic health. No, Sheila, you cannot forget. Please treat the PID first. Treat the PID first. Otherwise, you may be wasting your time. Right? Treat the PID first. Is that okay? So the next thing you need to do is to protect your metabolic health. Right? Why? Because when you have a stable insulin function, what happens is that your hormone is regulated. Ovulation becomes consistent. Mercury said, what is PID? PID is an acronym for pelvic inflammatory disease. And that is a vague umbrella for inflammation and infection that occurs within the pelvis, like endometritis, infection of the endometrium, cervicitis, infection and inflammation of the cervix, uveitis, inflammation around the ovaries, salpingitis, infection of the fallopian tube. So it's a vague word. So if there is PID, treat PID and you'll be all right. Then continue to knack, right? Knack waiting no good. I'm telling you, it's not laughter matter. Knack waiting no good. And by the way, if you are treating PID, treat as a couple, right? Treat as a couple, so that you don't treat your own, then you go back and collect. Right? So treat as a couple. So that is Dalu. Is that Igbo? I think it's Igbo. How do you know you have PID? There are several symptoms now. You have lower abdominal pain, offensive discharge, right? Offensive discharge, and that can even amount to menstrual irregularities in your menstruation, and so on and so forth, right? So, but the chief of them is lower abdominal pain and offensive discharge. Is that okay? You can go to the clinic. They will do an ultrasound scan plus some lab tests like high vaginal swab, urine, MCS and stuff. Get out of here. Anyway, where was I? So what you can do again is address any underlying conditions, right? Early, if there is a problem with your menstrual health, like this one we're talking about, PID, take care of it. If you have painful period, go to your doctor and find out why. If you have abnormal periods, go to your doctor and find out why. Don't ignore it. That's how to maintain a healthy menstrual function. And this one, I love it. Maintain nutritional support. Eat well. Nutritional support. Eat well. You need nutrients, adequate nutrients. You need iron, right? You need to be hydrated. Balanced diets, and many other things I put in this book. The preconception blueprint. I mentioned all those things that can help your fertility in that book. So you go and study it, right? Because if you don't eat right, you may need to supplement. But I'd rather that you eat right than to be pursuing supplement all over the place. All right, guys, the biggest mistake that people make is that most people focus on how do I stop the symptoms. That is the problem. And it's not your fault because that's what you have been told. Treating symptom will not solve the problem. For example, you have headache and you are taking analgesic, that is maybe a paracetamol or whatever it is you use for your headache, right? You're only treating the symptoms. The headache is a signal that something is wrong with you. Just like you got an alert on your phone, right? Then you saw the alert, you read it and swipe it and delete it. Have you read the message? No. It's only the alert you saw. So stop treating symptoms. Stop treating symptoms. Treat the real issue. That's why you need to see your doctor. And you feel like you're not getting what you need to get from where you are, go and there's not only one doctor. There are doctors all over the world. Go somewhere else. Get a second opinion. Right? Because you should be asking a better question. Why is my cycle trying, what is my cycle trying to tell me by these changes I'm seeing? When you do all that, you'll be amazed. Bleeding is not random. Menstrual blood is not random. No, it's a biological communication. So when you are seeing it this month or the next month, you are looking at it. What is this trying to tell me? Oh boy, I'm thinking about you. Right? So if your cycle has changed, right? If the color changed, if the flow changed, if the timing changed, if clothing changed from what normal clothing should be versus what is not, right? Don't panic. Don't become hysterical. Don't panic. And also don't dismiss it. That's why I bring you information every night. So that you deal with your issues from a place of knowledge. Right now, when you see the next menstruation moving forward, you begin to notice the pattern. What pattern is normal to you? And how would you know when it has become abnormal? Don't just go walk in ignorance, right? Because when you understand those patterns, it gives you the power over your menstrual health. And oh boy, you know what to do when something goes wrong. Is that okay? When something goes wrong, you know what to do. All right, let's take one or two questions. If you have one or two questions, please send your request and come up. I want to hear from your voice. So while we wait for that, I want to say that a menstrual cycle is not just bleeding. Now it's not. It is hormonal data. It's giving you an idea. Remember, it's a report card. So it's giving you hormonal data. It's giving you ovulation feedback, right? And a monthly dossier of what is going on in your reproductive system. And when you learn how to interpret this thing the way I've taught you tonight, you stop fearing your cycle, right? You start understanding it. What is normal and what is not normal. make sure you watch the 2 previous issues discussions on menstrual cycle or menstruation. You get a well-rounded knowledge on how to handle these things. Guys, that's all. I don't tire. Ask me questions before I go.